Hey guys, this is Dr. Samir Islam. I want to thank you for joining me today. Today we're going to talk about diverticulosis. This is a very common question I get from a lot of people. They may complain about their diverticulosis or say that they have it and wondering if there's any complications or things they should worry about when they think about diverticulosis. So today we'll be talking about what diverticulosis is, what you need to do if anything, and what this can potentially lead to. So what diverticulosis is defined as is defined as just outpouchings in the colon that herniate through the colon muscle layers in areas that have high pressure. And this mostly is in what's called the sigmoid colon, which is the very left part of your colon. And so these are just small little outpouchings that are there within the colon. It's just from high pressure of feces going through. The risk factors for developing diverticulosis are a couple of different things. So one is a low fiber diet or even a high fat diet. These very commonly can make the stool more difficult to pass through, which should make you more constipated, which you can form these high pressure zones within your colon, which will lead to these outpouchings called diverticulosis. But advanced age can happen, and advanced age can be a risk factor for diverticulosis. In fact, almost 40% of people over the age of 65 actually have diverticulosis, and they may not be aware of it. And so as a consequence, as our colon gets older, the lining becomes weaker, which allows these outpouchings to occur. And some people may actually have a disease like a connective tissue disorder like scleroderma that can make you more prone for developing diverticulosis. So, what are the symptoms? And this is a very common question people have. I have diverticulosis. What are my symptoms from that? And you'd be surprised, the vast majority of people who have diverticulosis never have symptoms and they don't realize that they have symptoms. And so if you have diverticulosis, or if you seen on either an imaging test or your colonoscopy that you have diverticulosis, that's not a big deal. A lot of people have diverticulosis and the vast majority of people have no symptoms whatsoever. And this is very different from diverticulitis, which I'll talk about in a little bit. But diverticulitis is actually inflammation of those outpouchings, and that will cause symptoms. Usually left lower quadrant pain, fever, it'll hurt to push in that area, you may have some chills. So diverticulitis, which is inflammation, that can cause symptoms, but diverticulosis, which are just outpouchings, typically will not cause any symptoms to occur. I want you to be just know the difference. Diverticulosis is common. It's just outpouchings, no symptoms. Diverticulitis, which is inflammation, that can cause symptoms to occur. And so some ways we can treat diverticulosis if you have it is to increase your fiber. And what fiber will do is it will actually help decrease the risk for causing constipation, which can cause these outpouchings to occur. So usually 20 to 25 grams per day is what we recommend for fiber, including taking things like fruits and vegetables as well. Making sure you're regular with your bowel habits. So making sure you don't have constipation, you don't have hard stools. Make sure that you go to the restroom regularly and have consistent bowel movements. Diet. This is the biggest question I have about diverticulosis. What do I need to do about diet? I've heard about having to avoid things like seed, nuts, popcorn, things like that. Well, I will tell you there's been no evidence to suggest that that makes any difference for diverticulosis. So what I tell all my patients, if you have diverticulosis, and you enjoy popcorn, you enjoy seed, you enjoy nuts, do not worry about that. There's been no evidence to suggest that this will put you at higher risk for developing diverticulitis or causing any problems. You're going to see a lot of things on the internet saying to avoid these things. Nobody knows if that's true or not, and there's no current recommendation that says that you have to avoid those particular food items. So if you have diverticulosis, that in of itself does not mean you have to avoid things like nuts, seeds, or popcorn. If you enjoy that, go crazy. It does not make any difference whatsoever. Now, there are some complications that can occur from diverticulosis, and one of them is bleeding. About 5 to 15% of people who have diverticulosis actually have a GI bleed or bleeding from the rectum from these outpouchings. Usually it'll present as painless rectal bleeding, and it is the most common cause of bleeding in older individuals. And the other complication, like I mentioned before, is diverticulitis, or actually inflammation of the diverticulosis. Up to 25% of the patients who have diverticulosis may have an infection in those outpouchings leading to diverticulitis. That's usually the most common reason is due to stool being stuck in those diverticulosis to cause inflammation to occur. If you have that, you'll usually will have symptoms of fever, pain in the left lower quadrant, chills, you won't feel well, you have some tenderness in that area. And the way we can help diagnose that is with a CT scan. We can see inflammation of that area within your colon from a CAT scan or a CT scan. And the treatment for diverticulitis is antibiotics. So in summary, diverticulosis is just defined as outpouchings in the colon, usually due to either diet or age. The symptoms are basically none. And so if you have diverticulosis, most people do not have symptoms, nor are they aware that they have that. And the treatment for diverticulosis, typically you may want to make sure that you keep on a regular diet, you have regular bowel movements, whether it's increasing your fiber, eating fruit, or having vegetables. But with respect to diet, there is no recommendation for dietary changes. So if you have diverticulosis, don't worry about avoiding meats, seeds, nuts, popcorn, or things like that. There are a couple of complications that can occur with diverticulosis that includes bleeding and infections, so just be aware of that.